The National Health Insurance Fund has issues emerging where it has been found that millions of shillings were lost through fictitious salary payments and inflated contracts. The Auditor General's report reveals how millions of shillings were siphoned from the fund by inflating contracts by up to 296% and manipulation of weak ICT systems to fraudulently draw huge sums of money through dubious medical claims. Brenda Wanga now reports.
Guys.
Even as the country digests the loss of 20 billion shillings at the National Hospital Insurance Fund through fictitious medical claims, another report by the Auditor General received at the public health insurer in mid-September 2023 reveals more rot at the fund where millions of shillings were siphoned through payroll as salaries and allowances. The Auditor General flagged what it termed as overstatement of staff cost. The financial reports show that for the year ended June 2022, NHIF reported it had compensated its employees to the tune of 4.86 billion shillings. However, the Auditor General's audit shows only 4.81 billion shillings was instead used, leaving close to 50 million shillings whose expenditure could not be accounted for. The integrity of the NHIF payroll was also called into question, with concerns raised about how some employees were overpaid salaries and allowances. 15 staffers were overpaid a total of 536,800 shillings in the year 2021-2022 as house allowance, while 17 staff members received a total of 1.62 million shillings as acting allowances, an amount that was an overpayment, while 2 interdicted staff members were paid more than half their basic salaries, and 5 staffers earning their basic salaries amounting to 8.28 million shillings while they were on suspension. The procurement processes at the fund were also found to have been abused. Contracts totaling to 306 million shillings were improperly executed. The report indicates that 5 contracts for the period ending June 2022 raised the red flag in the sense that they started being implemented before the contract was even signed. The Auditor General found in its audit of the fund's information system that the fund had inflated the budget for the procurement of ICT-related licenses by up to 296%. The licenses had been projected to cost the fund some 12.105 million shillings, but the actual expenditure came to 48 million shillings. The IT infrastructure acquired through these tenders, however, were not all put to use. For instance, 1,700 endpoint antivirus licenses worth 7 million shillings were bought, but only 823 of these were active, while 877 were unutilized.
The government, in collaboration with relevant stakeholders, is resolute in ensuring those responsible for these reprehensible actions are brought to justice, and our health.
The audit also found that the NHIF's database and operating systems had security challenges that exposed the fund's information systems both internally and externally to threats, with the Auditor General warning that these weaknesses could compromise the confidentiality, integrity, and availability of the information, including its financial data. Indeed, the reports flag out instances where it shows that some healthcare providers inflated claims through manipulation of data in the systems, while others were able to push for payment of claims without proper documentation. The report from the Auditor General is also forming part of the investigations into the fraud at the NHIF that is currently being undertaken by the EACC. Brenda Wanga, Citizen TV.